the sciatic nerve is the largest and longest nerve in the body. And for that reason, it innervates tons of muscles in the lower extremity, especially on the posterior chain. But as we get into the lower leg, both anterior and posterior chain muscles, and it has this huge sensory component. So it gives us feedback from the environment about everything that we're feeling and how we're moving. So from both a sensory and motor perspective, the sciatic nerve is extremely important. In this video, we're going to talk about the pathway of the sciatic nerve, the muscles that are innervated, and common sites of entrapment. The sciatic nerve comes from the ventral rami of L4, 5, S1, S2, and 3, and it dives down in the lumbosacral plexus. It converges as those 5 nerve roots and goes down through the greater sciatic notch. For some reason, I think many people would assume that it goes over the glutes on the backside, but it actually dives down deep through the pelvis. And potential sites of entrapment in the lumbar spine and pelvis are going to be because of the potential disc herniation, because of degenerative disc disease in the facet joints, or central canal stenosis where there's not enough room in the spinal cord. But it comes from the L4 to S3 nerve roots, dives down through the greater sciatic notch, and then at this junction here, because of how it lays close to the, like underneath the glute muscles and then superficial to the piriformis, another potential site of entrapment can be tightness in the hip external rotators, specifically the piriformis muscle that runs across here. As the nerve continues down from the pelvis, there's 2 distinct branches, the tibial and common fibular branches of the sciatic nerve that run centrally down the posterior thigh, and it runs deep to the hamstring muscles. In the posterior thigh, there's muscular branches to each one of the hamstrings. And for this reason, because it runs right through the hamstrings, individuals who have sensitivity in the sciatic nerve, as you run your hand across there, it'll almost feel like an al dente noodle. And if you're sensitive or if you're having issues with the nerve, it's going to feel very sensitive in the posterior thigh. Around where the hamstring muscles bifurcate here and turn into tendons that cross the knee, the nerve will branch there into its distinct tibial and common fibular branches. And this is where the sciatic nerve becomes more complex and more interesting. The tibial nerve runs down the backside of the calf, and because of that, it innervates the gastroc, the soleus, the plantaris muscles, as well as the muscles of the posterior compartment of the thigh. And so that's going to be your posterior tibialis, your flexor digitorum longus, your flexor hallucis longus. As the nerve continues down, it has these muscular branches, and then it drives behind the medial malleolus. So it drives medially and then branches off into 3 distinct branches. You have your medial and lateral plantar nerve, which go across the bottom of the foot. They give innervation to the sole of the foot, and they give muscle activation to the small intrinsic muscles of the foot. The medial and lateral plantar nerves, I think about a lot of things as synonymous in the upper extremity and lower extremity. In the upper extremity, the ulnar nerve drives here and then branches out into many of the intrinsic muscles of the hand. The tibial nerve of that branch of the sciatic nerve, which is medial and lateral plantar branches, those innervate many of the small muscles of the foot. The last branch is this calcaneal branch, which is a sensory nerve that gives innervation to the inside of the heel. The other branch is the common peroneal nerve, which drives around the fibular head in the knee, and it too has 2 distinct branches. So it's the common fibular nerve, it wraps around the fibular head, and then has a deep and superficial peroneal nerves. The superficial nerve is the easier of the 2. It runs laterally and innervates your peroneus longus and peroneus brevis. And so that helps turn the foot up and out that way. That's the superficial peroneal nerve. The deep peroneal nerve runs deep to the tibialis anterior and the anterior compartment muscles, and then runs down across to the dorsum or top of the foot. The deep peroneal nerve innervates your tibialis anterior, your extensor hallucis longus, extensor digitorum longus, and it's the activation of that nerve and muscles help pull the toes up and dorsiflex the foot. The other branches of the deep peroneal nerve are going to be your sensory branches to the dorsum or top of the foot here. Those branches are your medial and intermediate dorsal cutaneous nerves. So when someone has a lateral ankle sprain or an eversion ankle sprain, oftentimes the intermediate and medial dorsal cutaneous nerves can undergo traction or a quick stretch, and that can lead to sciatic nerve irritation as it is getting stretched and worked during rehab. Sites of entrapment for the sciatic nerve can include anything that can entrap the nerve through the L4 to S3 nerve roots. So that could be a disc herniation, foraminal stenosis, central stenosis, degenerative disc disease. As the nerve works its way down, it can receive entrapment in the piriformis muscle or even deep in the hamstring muscle bellies, depending on tightness along the hamstrings and posterior thigh. As the sciatic nerve branches into the tibial and common peroneal, we can see irritation along the fibular head with that branching. We can also see irritation in the common peroneal nerve as we talked about earlier with an eversion ankle sprain. Lastly, for the tibial nerve, we can see entrapment or irritation at the junction of the tarsal tunnel on the medial ankle. And that can be, if you've heard of tarsal tunnel syndrome, that's those branches of the tibial nerve that then extend into the foot, creating medial-sided heel pain, difficulty activating the intrinsic muscles of the foot. Take-home points here is that we can see entrapment both proximally and all the way distally, so anywhere from the spine level down to the foot and ankle level. And with that, we need to think about the nerve as it moves across the entire thing, making sure you both have proper sensory innervation and muscle activation of all the different muscles of the sciatic nerve.